Good afternoon. If you are coming to National Disability Institute's presentation on navigating Social Security Administration disability benefits while working, you're in the right place. We're going to give it about one more minute just to let a few more people trickle in, and then we will get started. All right. Well, we will get started now. So, hi, my name is Becky McDicken, and I am with National Disability Institute. I am a director of financial empowerment. We are here today under the project of Inclusive Healthy Communities in New Jersey, brought to you by New Jersey's Human Services Department and Division of Disability Services. Next slide. I think it's actually me. So I'm going to be your host today, but we do have a guest speaker joining us as well. Next slide. We have ASL interpretation for today's presentation. There will be two interpreters, and they will switch off periodically. If you're having any trouble viewing the ASL interpretation, please let us know via the Q&A box. Next. There is also captioning options for today and audio. It can be accessed through your computer audio or by calling on the phone. If you select computer audio, please make sure your speakers are turned on and your headphones are plugged in. To call in for audio, please dial 877-853-5257. Then the meeting code is 894-4562-4074. Real-time human captioning is being provided, and they can be found by clicking the CC button in the Zoom controls at the bottom of your screen. If you don't see the captions after clicking CC, please let us know in the Q&A box. Next. If you have any questions during today's webinar, please put those in the Q&A box as well. We have people behind the scenes answering some of those questions. The presenter will also answer questions if time allows. If your question is not answered during this webinar and you're listening by phone and can't use the Q&A box, you could always email us, and it's Kish Pisani is our contact, and that is KPISANI@NDI-INC.org. That's Kish's email, so you can always email her. Please also note the webinar today is being recorded, and the materials will be available on our website in about 1 to 2 weeks. We usually get things up and running. Next. So just in case you're not familiar with NDI, we are a national nonprofit organization dedicated to building better financial futures for people with disabilities and their families. We were the first organization committed exclusively to championing economic empowerment, financial education, asset development, and financial stability for all persons with disabilities. And right now we're celebrating our 20th anniversary, so it's an exciting time to be at NDI. Some of the things that we do, we build capacity of field staff through training and technical assistance opportunities. We drive systems change by implementing different models that can be replicated throughout the country. We test innovative approaches to financial empowerment and then report on those things and share out. And that leads to research, which can uncover barriers and new opportunities for us and people with disabilities. Lastly, we advance change through public education and policy development. We have lots of staff in Washington working on the ground. All right, we're going to get started first with a poll. So if you would pop that poll up, Shelby, we're going to just start off by finding out your knowledge today. If you could answer on a scale of 1 to 4, which 1 being not well at all and 4 being very well, how well do you understand how work affects SSI, SSDI, and other benefits? Give us a quick answer and let us know. Okay. Got a good mix of everybody coming in. Get your votes in. Not all of you are voting. All right. Well, we're going to end the poll for now. And if you're being shy, that's okay. But what we're going to do is move on now to our presenter for today. I would like to introduce you to Amira Hassan. Amira is with Family Resource Network, and she's a licensed social worker and project manager for New Jersey Wins. She's been with the program for 12 years, which is why we've invited her here today. And if you don't know, New Jersey Wins is New Jersey's Work Incentives Planning and Assistance Program, or WIPA, which provides benefits counseling to Social Security disability beneficiaries who are working or interested in working. In her role, she oversees program operations and works with partners across the state to ensure individuals receive accurate information and support in order to make informed decisions about employment and their benefits. With that, Amira, thank you so much for joining us today, and I will turn things over to you.
Thank you so much, Becky. Thank you for having me, and thank you everyone took time out of their day to attend this webinar. I'm just going to jump right in and get started. Next slide, please. So the New Jersey Work Incentive Network Support is a Social Security benefits and counseling program that was set up over 20 years ago. And so we've been in this business for over 20 years. And we are funded through the Social Security Administration. Pictured here is one of our beneficiaries who is very, very proudly holding her very first paycheck while being on disability benefits. Her hesitation to work was that she was afraid of losing her cash and her medical benefits. So we helped her with that, and here she is, employed and holding her her first paycheck. Next slide, please. So the New Jersey Work Incentive Network Support is a program of the Family Resource Network. We provide free benefits counseling to SSDI and SSI beneficiaries and helping them understand how work may affect their benefits, both cash and medical. The services are provided by our certified work incentive coordinators who help beneficiaries make these informed decisions about returning to work and achieving financial independence. We've been created over 20 years ago, and we continue to provide services in the state of New Jersey, and hopefully we will continue to do so moving forward. Next slide, please. So what is the Work Incentive Planning and Assistance Program? This program was funded by the Social Security Administration to provide benefits counseling services to beneficiaries after seeing such a gap in services and such a hesitation with individuals wanting to go back to work, but also afraid of their benefits being impacted. So this was created to kind of fill that gap in service and help beneficiaries make those informed decisions moving forward. We cover every county in the state of New Jersey except for Bergen, Essex, Hudson, and Union. Those are serviced by the Goodwill of Greater New Jersey and New York. Next slide, please. So why does benefits planning matter? Individuals have a fear of losing their benefits, and it's a major barrier to employment. People work, and understandably so. It's very hard to get on those SSI and SSDI benefits. Sometimes it takes months and months. Sometimes individuals are denied and have to appeal that decision and work really hard to get approved. And so losing those benefits would be a shock to anybody and would be a barrier to anybody in terms of moving forward with employment. So in order to understand the complex rules that are often misunderstood and misinterpreted, this program was created, and benefits planning matters so that we can give you the information that you can then take and move forward with employment in whatever capacity you feel works well for you. Next slide. So the goals with benefits planning are to empower beneficiaries making informed work decisions, increase employment outcomes, reduce fear of misinformation, and promote effective use of work incentives, which I will discuss a little bit later. Next slide, please. So the way that it works for us is we do an intake. So we receive the referral from a partnered agency, and we do an intake which which entails detailed information being collected, work goals and scenarios discussed during that intake process. So if the individual is currently working or has a pending job employment or a pending job offer, we go through those work goals. If an individual is contemplating working, We talk to them and kind of probe on work scenarios in terms of what they want to earn in an ideal world, what would be the monthly income an individual would want to make, and we base of our reports and our benefits counseling off of those scenarios. Individuals are prioritized based on the SS guidelines for triage, and we ensure timely support for those most in need. Next slide, please. In order to effectively do our work, we do need to obtain signed consent forms. So it's a release of information request. And this release of information requests allows us to receive what is called a benefits plan inquiry. And it's essentially just a snapshot of your Social Security benefit, letting us know any work incentives you may have used when you begin to qualify for your Social Security benefits and your medical information, which all goes into helping us provide the most accurate information for you in order to make informed decisions for work. We also verify other state and federal benefits and advise you very loosely on how those benefits are also impacted by work. Next slide, please. So for the benefits summary and analysis report, which is a report every beneficiary who signs a release of information request receives from us, we analyze how earnings will impact benefits. We identify and explain any work incentives that individual has already used or has available to them currently. And we prepare and we send the report for review by the individual. Next slide, please. So what is the difference? What is the eligibility with SSDI and SSI? So with SSDI, you have to have a medical condition that meets the disability definition. The condition must prevent substantial work and expected to last at least 12 months. You've had to work long enough and paid Social Security taxes to earn sufficient work credits and be eligible to receive SSDI once you become disabled. You must have work history before your disability began. You must be under the full retirement age, and eligibility may fall under child disability benefits or disabled adult children or spousal benefits. With SSI, you must have a disability or be aged 65 or older. Disability must significantly limit the ability to work and be expected to last 12 months. You have to have limited income. So with wages, other benefits, other financial support, any kind of income, even allowance from a parent counts as income with Social Security for SSI. And you must have limited resources, less than $2,000 for individuals and $3,000 for couples. You must be a U.S. citizen, or meet qualifying non-citizen requirements, and you must live in the United States or U.S. territories. Next slide, please. So with Social Security Disability Insurance, or SSDI, these are the following work incentives that we review and that are available to every single person who receives SSDI. So the trial work period, extended period of eligibility, extended period of Medicare coverage, expedited reinstatement, impairment-related work expenses or subsidies. Next slide, please. So the trial work period is 9 non-consecutive months where an individual is allowed to test their ability to work. Social Security understands that individuals who want to go back to work and haven't been working for a very long time don't fully understand their capacity to work. How many hours can they work? What can they actually do in terms of employment? So they allow the individual 9 non-consecutive months to work and earn anything that you wanted to without your benefits being impacted in any way. The way that Social Security counts trial work months is if you earn $1,210 or gross per month. This is not a max and is not an earnings cap. It's just a guideline to let Social Security know that you've used one of your 9 trial work months. So individuals can be working under this amount and continue to receive that trial work period benefit for as long as they continue to work under that benefit. But you do have the 9 months to kind of work and earn anything without Social Security touching or bothering you for your benefits. Next slide, please. This is what a trial work period chart looks like that we provide to the individual. For this example, the individual was working and earning over that trial work period threshold, so they worked and used all of their trial work months consecutively. And this is what we show the individual. This is what we give every single one of our beneficiaries so that they can track and understand at what month their trial work period is going to end, at what month their next work incentive is going to begin, and what it looks like kind of moving forward. This only indicates 3 years, but we do give them a 5-year chart. Next slide, please. The next work incentive after you've used all of your trial work period months is the extended period of eligibility, and this begins immediately following the trial work period. So month 10 is when it begins, and this is where Social Security starts to look at your earnings to see if you continue to qualify for your Social Security cash benefit. And they measure this against what they call substantial gainful activity. So if you work and earn the substantial gainful activity amount or more, Social Security will say you're not eligible to receive your check. If you work and earn below that SJ amount, Social Security will continue to give you your check and allow you to receive that cash benefit without your earnings being interrupted at all. It is also really important to note that in the extended period of eligibility, your checks can fluctuate in terms of 1 month you're getting them, the next you're not, depending on what it is that you're earning. So this is a 36-month safety net, essentially. Next slide, please. So the substantial gainful activity for 2026, every single year it indexes up based on the cost of living adjustment. So for 2026, that amount is 1,690 gross. So what that means is Social Security will look at what you're earning for the month, and if you earn and work and earn $1,690 gross or more for that month, you will not be eligible to receive your check. If you work and earn less than that, you will be eligible to receive your check. So it's either you're getting it or you're not getting it. Next slide, please. There's also the extended period of Medicare coverage that gives you Medicare coverage after work begins and can help you retain Medicare coverage for up to 93 months after that trial work period is over and you enter that extended period of eligibility. Even if you were to lose your SSDI check, your Medicare coverage can continue for up to 93 months, regardless of whether or not you're getting that cash benefit. Next slide, please. So expedited reinstatement is a really good benefit. We're actually seeing it a lot more now than we have been before. Expedited reinstatement is available after that extended period of eligibility period. So after that 36-month EPE period, if you were to lose your check, but you're working and you're enjoying your work and you're earning enough money to sustain you and you're like, I don't care for this SSDI cash benefit, I'm okay. And then something happens. You lost your job. Year 3, you've lost your job or you can't work anymore and you need to get back on SSDI. You would contact Social Security and you would request expedited reinstatement. And so Social Security would then send you 6 months of provisional payments while they review your SSDI claim. And then once they say that you are approved and that everything's good and that nothing has changed from before when you were collecting SSDI, you get a brand new trial work period and an expedited reinstatement period. EPE period after your reinstatement period is over. So next slide, please. Impairment-related work expenses are expenses that you pay out of pocket related to your disability that is needed for work. So for example, co-pays for any kind of medication that you may take qualifies as an impairment-related work expense because you need that medication related to your disability in order to go to work and continue working. The full value of the impairment-related work expense is deducted from your gross earnings. So if you're just a little bit over that that SGA amount, that 1,690, we can use impairment-related work expenses to help bring you down below that 1,690 in order to continue to become eligible for your check and receive your check. Next slide, please. So examples of impairment-related work expenses are as followed on the screen. So any kind of transportation costs can sometimes be impairment-related work expenses. I've seen Social Security approve sometimes they'll approve an Uber cost, bus fare, etc. It kind of just depends on the situation. Any kind of medical devices, anything drug-related, non-medical appliances and devices, anything like that. Next slide, please. So subsidies and special conditions, we do review this based on whether or not an individual is eligible for them or has them during our intake process. So you have employer wage subsidy, job coach subsidy, unsuccessful work attempt, or income averaging. So the costs assigned to subsidies are subtracted from the monthly gross to arrive at a countable earnings figure that would allow SSA to count a beneficiary who is making at or above SGA below. So this is another thing. Again, if we're seeing an individual who is at SGA or over SGA, we are looking for impairment-related work expenses. We're looking for subsidies. We're looking for special conditions. We're looking for anything that could potentially assist the individual in being below SGA and to continue to earn that benefit without any interruption. Next slide, please. So SSI, supplemental security income, is very different than SSDI and has a bunch of different work expenses and work-related incentives. So the following work incentives that we discuss with our beneficiaries are on the screen: earnings reduction formula, 1619B Medicaid, impairment-related work expenses also apply in SSI. SSI, we see blind work expenses for an individual who is visually impaired, and that is how they're receiving their SSI. Student earned income exclusion for anyone under the age of 22. Plan to achieve self-support for individuals who want to save for a specific work goal, or Medicaid buy-in, which is the New Jersey Workability Program for individuals who don't qualify for traditional SSI Medicaid, maybe due to work or due to earnings, or due to savings. So this would be a way to get in through Medicaid. Next slide, please. Okay, 1619A. This is where I tend to lose a few people, so I'm going to try to explain this as easy as I can. So it's the income test formula determined by the Social Security Administration to see how much they need to reduce the SSI by when an individual is working. So SSI cash benefit will fluctuate based on earnings. And there is a break-even point, which means an individual earns X amount of dollars before their Social Security zeroes out. This is information that we provide to our beneficiaries. We provide them the break-even point for their benefit. We provide them the income test formula based on their work goal, and we show them all the calculations and how Social Security would do that for them and what to expect moving forward for their new SSI cash benefit. Next slide, please. 1619B is continued Medicaid coverage under SSI. If an individual is working and earning enough to hit that break-even point, so the point at which the Social Security zeroes out and the individual no longer is getting an SSI cash benefit, their Medicaid will continue through 1619B Medicaid. It's the same same Medicaid rules in terms of resource limit and annual earnings threshold. It's just the way for the Medicaid to continue uninterrupted if the individual is working enough to zero out their SSI and no longer be eligible for an SSI cash payment every month, or if they lose it to SSDI. But then there's also something else called the Pickle Amendment. Again, it's just so many terms, but it's Medicaid through a different door, essentially. Next slide, please. So the New Jersey Workability Medicaid buy-in program is another door through which an individual can obtain Medicaid. It's designed for individuals who are disabled who work to be eligible for or maintain eligibility for Medicaid coverage beyond the standard income and resources allowable. So if an individual is retaining too much in resources, or if they're earning above that Medicaid threshold, they're able to apply for New Jersey Workability Medicaid, which is a buy-in Medicaid program. And depending on where they fall in that federal poverty level is incumbent on whether they're going to pay that copay or not. The copay is based on the FLP percentage, or FPL, federal poverty FPL. Next slide, please. So impairment-related work expenses, it works the same exact way as with SSDI, as I explained prior. You must need it for work and pay for it yourself. Unlike with SSDI, which you get dollar for dollar. So if you pay $100 in copays for medication, Social Security will take that $100 and help reduce you below that SGA amount. With SSI, it's only half of the cost of the reimbursement. So if you're paying $100, Social Security will only count $50 towards your SSI. Next slide, please. So for blind work expenses, they work the same as with impairment-related work expenses. They're just only available to individuals who are blind or visually impaired as their main disability or disability with Social Security Administration. They can deduct any work-related expense, and it does not need to be related to their visual impairment or the disability. They must need it for work and pay for it out of pocket themselves, and it helps reduce the total accountable income, which we've seen before. Next slide, please. So this is a list of the blind work expenses. They're called BWE or BWEs. So guide dogs, any kind of union or professional fees, transportation to and from work, even meals consumed during work are considered blind work expenses, and an individual can take their receipt if they go to Chipotle and take that receipt and submit it as a blind work expense, and Social Security will accept it. So this is a really great work incentive for those individuals who are working and receive SSI, use this blind work expense in order to retain the most they can with their SSI and continue to work. Next slide, please. Student earned income exclusion is a benefit that is available to individuals who are under the age of 22, not married or head of households. Social Security counts this if an individual is working and is still regularly attending school, to exclude the first $2,410 gross that they earn per month. So we see a lot of students who work during the summer use this work incentive, and the SEIE essentially just zeroes out their entire paycheck. So what that means is if an individual is working and earning $1,000 a month, and they're under the age of 22, regularly attending school, they can go to Social Security and say, I want this work incentive applied. And that first $1,000 that the money that they're getting from work, which is less than the 2,410, is excluded from their earnings. So they'll get their full SSI check, they'll get whatever wages they earn from work, and nothing will change. Next slide, please. So the plan to achieve self-support is a PASS plan. And this is a way to save for a big ticket item. So a lot of individuals use this to save for a car. This is not like the ABLE account. This is completely separate and unrelated. So PASS has to be tied to a work goal, and it has to be in writing. There's a PASS application that is done through Social Security Administration with what is called the PASS cadre. And an individual applying for a PASS plan is expected to increase a person's prospect for self-support. You're also supposed to be able to show to Social Security that with saving this money, with excluding X amount of dollars into putting into this PASS plan, you can still financially support yourself. Next slide, please. So a pass is not a loan. You have to list your monthly expenses. Again, you must be able to show how you will meet the monthly expenses without the money you're committing to the pass plan. The pass does also have a time limit. It's not like a savings account that's going to go on for X amount of years. There is a limit, there is a time frame on that pass, and the money that you put into it is saved off with the pass cadre. And once you hit your pass goal, so if your goal is to save $1,000 and you hit $1,000, whatever your pass plan was written for, so if it was written for a car, that money has to go to the purchase of that car. Otherwise, Social Security is not gonna like it. Next slide, please. So benefits counseling and work incentive planning. So with us, we go through everything. I hit you with so much information today, but we review all of that with our beneficiaries, and we speak in very specifics with an individual based on their current work goal or their current work, what their intentions are. They want to keep their SSI, I'm sorry, keep their benefits, lose their benefits, keep their medical, whatever it is that they feel that they need in order to be successful moving forward. We write all of that in a report. We review the report with them, and we discuss the next steps based on their goals using target dates. And we offer follow-up support and long-term follow-up support to reduce overpayments and any kind of potential disruptions or errors with their benefits, which is a really, really important thing. Nobody wants to have an overpayment or lose their benefit because they forgot to report their earnings. Next slide, please. So for Title II benefit, contact your local SSA at the start or end of your employment status. Provide SSA with employer details so your record can be updated for wage reporting. Keep track of the use and completion of your trial work periods. Follow up with SSA to determine the eligibility. And if you have identified potential IRWs, please send and share with your Social Security administrator. So this is what it would look like when we're sending our follow-up plan or any kind of like follow-up support with target dates. So we'll tell them, you know, you need to follow up with Social Security to determine the beginning and end of your extended period of eligibility, or you need to contact your local Social Security office in order to report your earnings, and we'll tell them when they need to report their earnings and how often. Or if they're going to record their employer with Social Security so that they can report their earnings online, we help walk the individual through that as well. So anything an individual needs in order to be successful and be financially independent, and we help them with that, and we help kind of give them the confidence and the information to do that moving forward and make the best decision for themselves. Next slide, please. So again, this is kind of the same as the previous slide. It's just more kind of essentially like a to-do list for our beneficiaries and for ourselves as well, because we also have times where we have to follow up with the beneficiary in terms of something we've discussed that we need to then reach out to them to make sure that it was done or it was completed, or what the next steps would be, any kind of follow-up or letters from the Social Security Administration that an individual receives. We review that as well and do follow up with that as well. Next slide, please. This is the same, just kind of with the follow-up plan. It's just more information that we provide to the individual. Next slide, please.
This is where we're going to break in and take another quick poll before we let you finish up, Amira. So we've got a couple more questions for our participants. What are the main purposes of Social Security work supports, and what should someone do before they start working, even if they receive more than one public benefit? So if you would be so kind as to pop your answers into the poll. I'll give you a few more seconds here. All right. You're all being shy today as far as taking polls. All right, well, we're going to close that out so we can continue just a little bit more with Amira, and we will continue now. So next slide.
Okay, so what are some common misconceptions with Social Security? If your first application is denied, you don't qualify. We've had a lot of individuals who will tell us, I applied for Social Security and they denied me. I don't know why they denied me. And so we just tell them, appeal the decision. And most of the time after that, the decision is appealed, they get approved for Social Security. Next myth is SSI will stop at the age of 18. That's not true. Social Security conducts an age 18 redetermination to just ensure that eligibility for the benefit still applies. Another myth is only a physical disability qualifies. That's not true. Mental health conditions can qualify. Severe depression, schizophrenia, bipolar, autism, etc. also qualify for an individual receiving or to receive SSI or SSDI. Next myth is Social Security will know you're working because you pay taxes. We hear this a lot when we ask individuals, have you reported your earnings since you started working, 2 years ago? And they'll say, no, I pay my taxes. Social Security knows that I'm working and they know what I'm earning. They don't. Social Security will eventually find out when you report your earnings to the IRS, and the IRS system and the Social Security system communicates. But until then, they don't know, and you have to report your earnings to the Social Security Administration. Another myth is once approved, benefits last forever. That is not true. Social Security periodically conducts continuing eligibility reviews to determine whether or not you are still considered disabled under their definition to continue to receive your Social Security benefit. And another myth that we've seen a lot and we've heard a lot is my doctor said that I'm disabled and I have the disability, so why hasn't Social Security approved me? They have to. And while a doctor's opinion is important and their diagnosis is important in terms of treating you as an individual and as their patient, Social Security makes its own legal determination once they review your application. Next slide, please. So common misconceptions about the WIPA program. WIPA is just information and referral. That's not true. WIPA is an intensive individualized benefits counseling and planning service. Another myth is WIPA is short-term and does not do follow-up. That is not true. Our cases never close, and we are required through our terms and conditions from our grants through the Social Security Administration to provide long-term follow-up as needed by the beneficiary. WIPA will report my income. That's not true. WIPA cannot report any employment or income on the behalf of a beneficiary. We can't even discuss anything with the Social Security representative on behalf of an individual. The individual either has to be on the phone or they have to be with the rep and then call us, and then we can kind of have a conversation. Another myth is WIPA decides or changes my benefit. That is not true. Working with us is 100% confidential. Like I said, we do not report to Social Security on any individual's behalf, and working with us does not trigger any kind of changes with the Social Security Administration at all. They actually encourage beneficiaries to work with WIPA programs. Another myth is WIPA will only help if you're already employed. That is not true. We will assist you at any point in your employment journey. Even if you're thinking about work, we will help you with a scenario, a work scenario that we discuss together. Another myth is we have a wait list. That's not true. If you contact us, we are required to call you back within 5 business days of our referral. Next slide, please. So why choose NJ Wins? There are other programs within the state of New Jersey that do this work fee for service. We do share the state of New Jersey with another WIPA program, Goodwill, Greater New York and New Jersey. They do cover the 4 counties that I stated in the beginning, but we are 100% free for everyone eligible for our services. It does not cost you a single penny at any point working with us. We have expert help in understanding the complex rules. Like I said in the beginning, we've been here for over 20 years. And I've been working for the program for over a decade, as well as the rest of the people on my staff. So we know what we're talking about. It's intensive, individualized planning that continues when needed without a hassle. Somebody can work with us today. We'll never hear from them. 2028 comes around and they're like, hey, remember us? We pick up right where we left off. Intakes are conducted within 5 business days from the referral. So you'll always get either a call or an email from a counselor scheduling an intake. We have access to Social Security approved software, so everything is accurate and based on what Social Security is doing or tells us needs to be done. We have a distinct service model that keeps cases open. We don't close any of our cases, and beneficiaries slide in and out of services as they need or as they see fit for them. Follow-up is a core function of our model. So follow-up is very, very key for our services. So following up with, have you reported your income? Do you have any IRRIs that you've identified? Do you have any other questions? Or, oh, you've quit your job, you've gotten a second part-time job. And so we re-interview, redo intakes, and we do multiple reports sometimes for one person, just kind of depending on their employment journey. Because we all know that counseling evolves with employment, and it's never just like a one-size-fits-all for everyone. Next slide, please. So connect with us. Again, it's free. There's 2 ways to connect with us. The first way is to contact the Ticket to Work helpline, and the number is on the screen. You can also go to choosework.net, I believe, and get that number information through there. I will say with contacting the Ticket to Work helpline, they are great, and we receive majority of our referrals from them. They will only send individuals who are either currently working, transition-aged youth, or individuals who have like a pending job offer. If you call and you say, I'm looking for work, or I kind of want to work, but I don't know the rules, they're not going to send your referral through. They're going to give you some information and say, thank you, have a nice day. If you want to avoid any of that, just email us directly, njwins@familyresourcenetwork.org. You send us an email and we'll reach out to you as soon as we can. So usually within that 5 business days. And that is at any point within your employment journey. Even if you have a couple of questions, you can email us directly. I think that's it for me. I think this was the last slide.
Well, thank you so much, Amira. I'm going to give people an opportunity to ask any questions. If you have questions, you can put them in the Q&A box, please. But before you go as well, I do want to mention there will be a pop-up evaluation for today's webinar. Please take that. But I also want to tell you, if you could go to the next slide for me, we've got a couple of other opportunities coming up in New Jersey. And we have the last of our, oh, I'm sorry. We have a poll first. Let's do the poll. My bad. So we want to know how you feel today after this webinar on a scale of 1 to 4. We started off with this back at the beginning. Do you feel you understand things better than you did at the beginning? So 1 is not well at all, and 4 is very well for how well you understand how work affects SSI and SSDI. And then the second question is, how would you rate your understanding of how those things work together, SSI, SSDI, and other benefits? And we're getting a lot of somewhat stronger, so that's great to see. There was a lot of information in today's program. So again, if you have questions, please do put them in the Q&A box. And we will end the poll, but glad to see, again, people feel somewhat better. So thank you so much for taking that. And then a couple things to note with us. We have another webinar coming up in our 4-part series. It's the last one. It's next month on April 29th from 1 to 2, and it's the extra costs of living with a disability and dispelling some other myths. And then if you've missed a couple of our previous webinars, they are online at our website, and I believe the link is in the chat. Also, we have coming up, next slide, we're going to be doing a Train the Trainer session this September. We're locking in the dates as we speak, but it's going to be in central New Jersey, mid-September, and it is a 3-day free training to learn how to be more effective in working with individuals with disabilities. We're going to get more into benefits. We're going to get into financial wellness, such as credit and banking, things of that nature. So we will encourage you to fill out an interest form if you're interested. We haven't started registration yet because we are finalizing the details for the location. The link for the interest form will be in the slides that we will send out after the fact, or they'll be, posted on our website. But I believe that link has also been put in the chat by Lori. So thanks to Lori. Going back now, are there any other questions today? Haven't seen anything come in. So I guess not. We don't seem to have any at the moment. I think you all do have Amira's contact information now, or Family Resource Network. But Amira, thank you again so much for joining us. What a wealth of information you are. And I will just say to everyone, we just got another question. I received SSI and Social Security sent me a letter stating they will cancel. I think we might need a little more information on that, but we can hang on and answer that question, I believe. Or we can get some contact information.
I would need to know, are you working? How much are you earning? Were you reporting? I would need to see the letter. So I would email us at njwins@familyresourcenetwork.org, and
Perfect.
we will contact you and kind of figure out what's going on.
Is Essex County in your territory, Amira? Here come the questions now.
No, that's Goodwill of Greater New York and New Jersey. So you would have to contact that Ticket to Work line, and they will reroute you to the appropriate project.
And the question about the slides, they will be posted on our website. If you go to the website in about 2 weeks and do a search for New Jersey, we have a whole page on our New Jersey Inclusive Healthy Communities Project with all the previous webinars, and this one will be there in a couple of weeks. And therefore, you can download the slides and other resources from there. Anything else? All right. Oh, trying to communicate through Zoom chat. Yeah, the chat I don't think is working. It's not enabled for you. We have to do Q&A. Sorry. Okay, well, I think we're going to call it. So again, thank you to everybody. If you have questions, you can also email us at NDI. I believe that the last slide has our or the next to last slide. There we go. There's my information. You can contact me as well, and we can connect you with Family Resource Network, or if it's appropriate, Goodwill, if you didn't get that information. So my email is bmacdicken@ndi-inc.org. And with that, we will just say, have a great rest of your day. Thank you so much for joining us. Bye-bye.